My name is Abigail DeKeen, and I'm going to be performing a head-to-toe assessment. I have my badge, uniform, no nails, no jewelry, and shoes. Right, so first I'm going to walk into the patient's room, knock on the door, shut the door behind me for privacy, apply hand hygiene, and put on my gloves. And then I'm going to introduce myself to the patient. Hi, my name is Abby. I'm going to be your nurse today. Can I please have your first and last name and your date of birth? As I'm checking his wristband.
Landon Brooks, 1, 2, 3, 4, 5, 6.
Thank you. So 2 patient identifier. The next thing I'm going to do is explain what I'm doing to the patient. Alright, so Landon, I'm going to be doing a head-to-toe assessment, which means starting at your head and working all the way down to your feet. Is that okay?
Yep.
Alright, so now that the patient has gave consent, I'm going to look at the patient's appearance. The patient appears well-groomed and no signs of any distress. He is sitting comfortably. The next thing I would do is check the patient's vital signs. So his blood pressure is 120/80. His heart rate is 65 beats per minute. His temperature is 98.8 degrees Fahrenheit. His respirations is 16, and his oxygen saturation is 99% on room air. So the next thing I'm going to do is I'm going to start from his head and inspect his scalp. So his hair is evenly distributed. There are no redness, and no signs of any infestations. Now I'm going to check his skin. Could you sit up for me? So I'm checking his shoulders and bony prominence areas. All right, you can relax. We check his arms. When I touch, is anything hurting? Let me know. Okay, checking his arms, elbows, right, legs, feet. All right, there's no abrasions, lesions, or rashes on his skin. There's no tenderness on his skin as well, or any bumps. The next thing I'm going to do is check his hydration. I'm going to do that by checking his skin turgor. I'm going to pinch right here. It's not going to hurt. Okay, there's no sign of skin tinting. After that, I'm going to move to the patient's face. So would you look at me? The patient's face is symmetrical. His eyes are symmetrical. I'm going to start by shining this light into your eyes. Look at me while I shine. Alright, now I want you to look at the tip of the light, or the pen light, and then the fan. So, light, fan, light, fan, light, fan. Okay, the patient's pupils are equal, round, and reactive to light and accommodation. No signs of any abnormalities. Next, I'm going to look at the patient's nose. The nose is symmetrical and intact. I'm going to look inside the patient's nares. Okay. Nares are pink and septum is midline, and no signs of any drainage. Next, I'm going to have you close one nostril. Breathe in and out. Okay, other side. In and out. Nares are patent. Now I'm going to feel the patient's sinuses. No signs of inflammation or tenderness. Now I'm going to look in the patient's ears. Ears are intact and no drainage or signs of infection. Now I'm going to look at the patient's lips. Okay, lips are pink and intact. And now I'm going to look at the patient's teeth. Open your mouth for me. All right, teeth are intact. Oral and buccal mucosa are pink and moist. Patient's uvula is pink and moist. Stick out your tongue. Tongue is pink and moist. No signs of thrush or any white spots on his tongue. Say ah. Tonsils are not swollen and pink and moist. And now I'm going to feel the patient's lymph nodes. I'm going to start up here. Okay, lymph nodes are having no signs of inflammation or tenderness. Now I'm going to inspect and look at the patient's trachea. Trachea is midline. So after that, I'm going to listen to the patient's lung sounds. Or do you have a cough?
No.
No? Okay. Also, backtrack to his skin. There were no signs of skin breakdown on the bony prominences. Okay, so now I'm going to listen to his lungs, posterior and anterior. Patient has no signs of a cough, so I'm going to start anterior listening. Just breathe normal. All right, go ahead, sit up for me. All right. Patient's breath sounds are all present in all lobes. His breathing is not labored. His chest is rising and falling symmetrically. There are also no adventitious breath sounds. The next thing I'm going to do is listen to the patient's heart. Patient's heart rhythm is regular. His rate and rhythm is regular. Now I'm going to check the patient's pulses. So first I'm going to do the radial pulses. Both arms like this, please. Okay, radial pulse is +2 bilaterally, and now I'm going to check the dorsalis pedal pulse. Dorsalis pedal pulse is +2 bilaterally. And now I'm going to check the capillary refill in his fingernails and toenails. Can I see your thumbs? Fingernails capillary refill is less than 3 seconds bilaterally. Capillary refill is less than 3 seconds bilaterally in the toenails. Now I'm going to listen to the patient's bowel. Bowel sounds? Would you go and lay down for me? The abdomen appears non-distended. Are you having any trouble with your bowels or bladder?
No.
No. Patient states no trouble with bowels or bladder. Now I'm going to listen to his bowel sounds. Bowel sounds are present in all 4 quadrants. Now I'm going to palpate the patient's abdomen. If you have any tenderness or pain, let me know. Abdomen is soft and no signs of any tenderness or pain. I'm going to have the patient sit up. Let's back up. All right. And when was your last bowel movement?
This morning.
Okay, patient states his last bowel movement was this morning. So now I'm going to have the patient sit on the side of the bed. I'm going to have you follow me. So first do this, forward, back, and circle. Client has full range of motion in his neck. And now I want you to put your arms out and go circle, other way, forward, back, okay? And put your arms up. I'm going to push down on your shoulders, so let me push down, okay? And I'm going to put your arms right here. I'm going to push on your arms, don't let me push, okay? Okay, patient has full range of motion in his upper extremities. Now I'm going to do his legs. Would you kick this leg? Okay, this one. Alright. Now I'm going to push on your legs. Don't let me push. Okay, now ankles. Roll them. Forward, back. Alright, and the same thing. I'm going to push. Don't let me push. Alright. Client has full range of motion in his lower extremities. Are you having any joint pain?
No.
Okay. Client states no joint pain. I'm going to have you stand up, and I want you to touch your toes. Okay? And then I'm going to push you. Don't let me push you. Okay? Client has full range of motion in his chest or in his back. Now I'm going to have you walk a few steps and walk back. And then you can have a seat. Okay? Client's gait is steady and his coordination is well balanced. No signs of uneasy or it's good gait. Now I'm going to ask you, I know I already asked you this, but what is your name?
Landon Brooks.
And where are we?
Hospital.
What month is it?
April.
So client is alert and oriented ×3. And on the Glasgow Coma scale, his score would be 15. His eyes, verbal, and motor response is all fully intact, so that's why his score is that. Are you comfortable?
Yeah.
Do you want to lay down or do you want to stay sitting?
I'll stay sitting.
Okay, perfect. Do you have any questions for me?
No.
No? Okay, so you know you're very healthy, so just make sure you keep doing the things that you're doing to stay healthy. I'm going to take off my gloves and put them in my trash. I'm going to apply hand hygiene. And that is the end of my video. Thank you.